What should be considered when planning a return to work after an absence due to cancer?
Well, I guess a number of things really. The classic issue when you're returning to work is the doctors never give you a great deal of advice on when you should do that. The normal answer is when you feel ready, and the problem often is that you feel like you're ready to return to work because you've been at home and in a safe environment and not particularly necessarily doing anything particularly physical or stressful. So you feel okay, and then of course you go back and it's not quite such a safe environment. So I think my watchword would be sort of expect the unexpected and prepare to be flexible, and your employer must prepare to be flexible. And I think it's important that, so first of all, you get some advice from your doctor, anyone else who you can, about what you should do in terms of your return, but then several weeks in advance meet your employer to talk about what might be possible in terms of reducing your hours or working more flexibly, perhaps possibly working from home, so you can gradually build up your physical energy and also your emotional energy in order to work effectively. And these are all reasonable adjustments. So you can ask, as I say, for coming in a bit later to miss the rush hour, particularly if you had chemotherapy and your immune system's crashed a bit. You could leave earlier, so you could perhaps work part-time from home. You can have breaks during the day. There's a lot of information about this in some of the, if you look at the Macmillan literature about what you can ask for. It's fundamentally asking for anything that will help you return to work, and your employer has a duty to consider that. The issue is, what is a reasonable request or not? What's reasonable for me might not be reasonable for you, but the larger the employer, the more they should be able to accommodate a sensible request.
Okay. So, yeah, as you say, a larger employer might be better placed than a smaller employer to accommodate your requests.
Yeah.
Do you have any advice if you're working for a smaller employer who might struggle with that?
I think it's again about asking for something that's reasonable. Actually, in many ways, smaller employers, because they tend to know their employees better, can sometimes be more accommodating because they know the individual and they've built up a relationship, and often a line manager will try and do more if they can. So it's an interesting issue. So I think it's about being open with your employer and being as flexible as you can be, but asserting your rights and being clear about your rights not in a demanding way, not in an aggressive way, but just being clear about what you think is going to work for you and for them. Okay. So think about it from a kind of win-win perspective. What do I know I can ask for that's not going to really cause my employer severe difficulties? So kind of bearing that in mind is a good thing to do.
Okay. So you talked about getting in touch with your employer before you go back to maybe lay down the ground rules.
Yeah.
What about your colleagues, your teamwork? Is it worth getting in touch with them, letting them know you're coming back? Is that your responsibility?
I think it's everybody's responsibility. I mean, I think it's important to talk about your cancer and how you are and what support you need right from the point of diagnosis. So there's a continuous process of communication from the point where you feel you can talk about your cancer through to the point when you're having to go off sick for your treatment, to the point of coming back, and then also when you're back at work, keeping your adjustments being made under review with your boss and your colleagues to some extent. I think it's very important to let your colleagues know, in whatever way works for you, about your diagnosis and your treatment and the fact you're coming back. Occasionally I have clients who say to me, I thought I'd just pop in and surprise everyone, and actually that can be really difficult for everybody to deal with. I had one client who turned up and there was somebody sitting at her desk. Some of her colleagues went, "Oh, you're back," in a kind of rather surprised and unhelpful way, and she was quite upset by that. So I think it's important to let people know how you are, how you're doing, how you want to talk about your cancer, how you feel about talking about your cancer. So there are no surprises for anybody, and people can support you.
Okay. So I guess you're saying that communication is really sort of
really,
key.
really critical. Yeah, I think the classic British response to these things, whereas we don't talk about these things or we say I'm fine, is actually amazingly counterproductive. And just to give you one example, I'm working with somebody who didn't tell her employer that she had cancer, has cancer, until she was in an appraisal discussion. When the employer was basically giving her an appraisal for bad performance. And of course, when the employer realised that they had cancer, they were A, mortified, and B, realised that of course their performance had suffered, but their relationship suffered as a result of that, because first question was, well, why the hell didn't you tell me about this? So I think the more you can talk about cancer, the more you can get the support you need. Communication is really critical.
Okay, thank you.